Well, there's an app for just about everything, and a coronavirus app that might tell you you're going into a coronavirus-rich environment. Dr. West is back with us this morning, medical expert and founder of the West Clinic. Doctor, thank you for joining us today.
You're welcome. And it's interesting is, you can't turn on your cell phone or your computer or your tablet without being barraged with information about the coronavirus. And when I saw this app that's out there, and again, as you said in your intro, there's an app for everything, but I'm not sure that you want this app.
How does it work?
So what happens is they have these things called chirps. And what chirps are is if you decide to voluntarily participate in this program, you turn on your app, and basically you fill in the information. Yes, I'm infected. No, I'm not infected, etc. And then it will send out data for other people that are participating in the app. That said that, like, if someone said I have the coronavirus and it has been around your area, it allegedly can go back 14 days, upload all of this data, and say you have been exposed or you've been around someone that's had the coronavirus.
So here's my kind of a two-part question, I guess. They've said that they're not mining any of your data or taking data from you. So how did they know you've been around a person that had COVID-19? Doesn't it seem like location would need to be a part of that?
Well, it's not necessarily going off location. It's going off what they call, a special type of Bluetooth activity. But it's these signals that go up, they're called chirps. This basically says, have you been around any of these people in the last 2 weeks that have voluntarily said that they have coronavirus? And so from an epidemiologic standpoint, for the disease, you want to know, where did the disease come from? Who's the person been around? Who have they come in contact with? So that you can put together some preventative parameters of anyone that contact has basically interacted with. So that's the epidemiologic part. The medical information and the medical ethics part of it are a lot bigger than that, because is it an invasion of medical privacy? And once the genie's out of the bottle, now what do you do? I mean, do you want to? And being from rural United States, where we think there's a communist behind every tree, our feeling is, well, I don't know if we really want, the medical information floating about there. I mean, it just causes some, concerns in the back of your head going, well, wait a minute, where do they stop?
Yeah, and again, just because it's sort of been around you doesn't mean you've had this one-on-one contact, right? So somebody from work says, I have coronavirus. You know that you were within 10 feet of them 3 days ago. That's a lot easier to have sort of a concrete idea that maybe you should get a test.
It's true. And, this is a really interesting thing that you brought up, because so many people are saying, all right, Dr. West, tell me what I can do so that I don't, be exposed to the coronavirus. And my response is, well, then you should figure out how to create this plastic bubble system that you can live in, because the real reality is, if this virus, as infectious as they say it is, which I think that's accurate, you're all going to come across it. I'm going to come across it. I haven't been sick since the pandemic started, but I work with sick people all the time. So I'm assuming unintentionally I've been exposed to the coronavirus. Patients are being exposed. Family members are being exposed. And one of the narratives that I wish was changing in the healthcare or the media was, man, there is a lot of people that have been exposed to the virus that are getting better, or that they're asymptomatic. It means their immune systems kicked in and got rid of this. And unfortunately, there are people that are, dying and struggling and having problems with the virus. But the numbers it's a really, really small percentage. I mean, we're caught up in the media. We're talking about all these infections and diseases, but for getting ready for the interview, I was looking at the data that's coming from England. And then a normal day in England, 1,700 people are dying every day from other diseases, and we're highlighting how many people have died of the coronas, but there's all of these other deaths that are occurring as well that I just wish sometimes there was more perspective in the media that's coming out. But, man, there's a lot of people that are getting over this.
The medical expert and founder of the West Clinic, Dr. Jason West, thanks again for your time this morning.